Good morning. It is 8:01. We will go ahead and get started. Welcome to Pediatric Grand Rounds. Today it's my honor and privilege to introduce our speaker, Dr. Michael Pitt. He's also receiving, and he's here as the T. Denny Sanford Distinguished Lectureship in Pediatrics. So as the recipient of that lectureship, we have a plaque as well as a gift basket for you.
Thank you. Thank you very much. You haven't seen me talk yet. You guys can
say that to the end. But so Dr. Pitt is a pediatric hospitalist at the University of Minnesota, where he's also associate chair for faculty development, associate pediatric residency program director, and the director for global health education. And as I was just talking with him now, he's taking over as the director of the Pediatric Hospital Medicine Fellowship as well. He received his bachelor's degree from the University of Florida, where he graduated with highest honors. After this, he completed medical school at Johns Hopkins School of Medicine, followed by a pediatric residency at Children's Memorial Hospital at Northwestern University in Chicago. After his training, he stayed on as a staff physician at Northwestern and then moved to the University of Minnesota. In the relatively short time since completing his training, Dr. Pitt has already accomplished a distinguished career. He's received many awards, including Faculty Educator of the Year multiple times, and as well as Faculty Development Awards. He has many peer-reviewed publications on a variety of topics, most notably in the area of global health and global health education. He's given numerous presentations at the local, regional, national, and international levels. He's also received state and federal grant funding for global health education. Outside of medicine, Dr. Pitt is an award-winning professional magician, performing nationally for corporate events, including several Fortune 500 companies. And he incorporates his skill into the bedside care of children. Today's presentation is entitled Magic in Medicine, Learning How to Think Like a Magician. I had the opportunity to hear Dr. Pitt give a very similar presentation at our National Pediatric Hospital Medicine Conference a couple years ago, and we are definitely in for a treat today. So please join me in welcoming Dr. Michael Pitt.
Something a little different. I'm going to have everybody stand up for me for 1 second. We're going to do a visual Likert scale. So I want to see your degree of having ever done a magic trick. So if you've never done a magic trick in your life, your hands will be here. If you had a library book as a kid, a magic kid, an uncle who pulled your coin from behind your ear, or you did magic, somehow got paid to do magic, hold your hands out like that for me. So this does two things. Mainly, it lets me text my wife that I got a standing ovation. So I just wanted to be able to do that. Perfect. Thank you. Have a seat. That was the main reason we did that. So this is exciting. This is a talk that's quite fun to give. I've done this now for about 3,500 pediatricians across the country, and my first time in South Dakota. We're coming back as a family in August to kind of do South Dakota right, but it was nice to do half the drive without the kids this time. So the disclosure slide in magic's a little strange because I'm going to break rules. Usually you're not supposed to disclose magic tricks. I'm going to teach you how to do some magic tricks in this session today. But I have no financial relationships with any of the tricks we do. There's no off-label magic usage, so no actual financial disclosures here. And really what we'll do is three things. We'll spend a little time just thinking about the similarities of magic and medicine. So why kids think in magic and how to leverage kind of that magical thinking. I actually don't like doing magic for young kids. We'll give some exceptions here because they go, well, yeah, of course that happened. It's magic. Like there's a space in which that's the answer to it, and I'm like, no, it's actually not going to prom and practice. No, I'm kidding. We'll spend some time in that space. So then we'll actually spend the most of our energy thinking about how to think like magicians. So apply the skills magicians have used for centuries in how they interact with an audience to think about the art of medicine as a performance art, and how magic can be a way of approaching patients kind of through that lens and change the way we interact with really in getting rapport, in understanding and getting compliance. So we'll spend a lot of energy there. But we will also learn some magic tricks. So I will tell you, and I'll say this several times, I'm a hospitalist. I do weeks of service at a time. I might go an entire week and not do a magic trick for a patient. So this is not about how to make you all clowns that do magic tricks, but I think about as a magician every single time I interact with a patient. That's really the goal of today. So we'll use some magic tricks to illustrate those points, but we'll really want you to get into that thinking space. So I did magic starting at the age of 8. I was on a talent show and a cruise. I didn't have a talent, and I wanted to do something, so I just wrote down the only thing on the paper that wasn't already written down as a talent. So I wrote magic, and I had 4 hours to learn a magic trick. So I bought a deck of cards in the gift shop and walked around the boat asking if anybody knew a magic trick. And did it that night on the stage, checked out all the books in the library, and then started doing birthday parties when I was 8, but did it 4 nights a week from 12 through really medical school in restaurants and trade shows and corporate events. But I knew as a kid, when people would say, what do you want to be when you grow up? I'd say a Christian, magician, physician, pediatrician. And I have been able to do all 4 of those. So I studied art history in college, and I remember looking at the similarities of magic and medicine kind of at a really early stage of that art study. So here's a famous painting by Bosch in the 15th century, and he's doing the cups and balls trick. It's called The Magician, and the cups and balls goes back to hieroglyphics, the 3 shell game, etc. But what I want you to notice is everybody's eyes are on the magician while his partner is pickpocketing them. So you can see him going behind and stealing money while he leverages misdirection. And we're going to spend a lot of time talking about what misdirection is and how to use that. And then we just think about what medicine has been for patients, really until the last 100 years, where there's germ theory and we understood and had kind of appropriate medicines. It was magic. It was, let me kind of listen to what you say, I'll give you some sort of potion, I'll say something, I'll lay my hands on you. And it really relied on the placebo in much of what we did in medicine. Who's ever reduced a nursemaid elbow? That is magic, right? I mean, that is the most magical experience for families who are devastated that they broke their kid's arm. You do a little hand wave, and 5 minutes later, they're reaching for bubbles and high fives, and you're a hero. I always want to rig confetti to fall when they start doing it, because it's such a great moment. But from our pediatric patients, that never changes. That perception, even if we give them an antibiotic, a 4-year-old, that's magic if they're feeling better or if something gets better. So really, that's a fun space for us to live as pediatricians. Believe it or not, there was a meta-analysis and systematic review of magic in the literature that was published in medicine that was published a couple years ago. And they ended up with 27 articles that kind of looked at 5 different categories of how magic had been used. So one was actually, interestingly, in the physical therapy space, getting somebody to be motivated to do an activity through learning a magic trick rather than just an obscure hand gesture or exercise. So there were some benefits there. A lot of the stuff we'll talk about is the role it's played in prophylactic anxiolytics, so actually in decreasing sedation requirements, decreasing, making people less anxious for a procedure, and I'll share a couple studies in a second. A lot's been in the child life space, just kind of how to leverage the fact that in pediatrics in particular, kind of magic can be a source of levity with our patients. Some interesting stuff in teaching magic to kids with social anxiety disorder. There's quite a difference if you have a kid. Did anybody do magic as a kid? Was that a thing for anybody in the room? There's something, when you know how to do a magic trick, it's very different than being a piano player or a violinist, where people go, oh, that's impressive. I can see how she does that. I understand conceptually how that's happening. Whereas magic, when you're a 9-year-old and fool adults, that's actually quite empowering. And so if you've got kids with social anxiety, it can be quite a level playing field for them. So they've piloted that in some group therapy work. And then there was one study that actually looked at trying to improve physicians' dexterity skills, surgeon skills, by incorporating some sleight of hand. So I'll talk us through 3 of those studies. I would recommend, this is a fun book on the neuroscience of magic. So what happens in our brain when we see magic and why that works. And there's also some other organizations that have brought magic to the bedside, less from the medical providers, but using it in kind of a child life therapy. So we'll go through 3 studies before we get our hands dirty. The first looked at functional MRI. Again, this is what is happening in the brain when we see a magic trick. Is it different than just being surprised? So for those that remember, functional MRI is going to light up the part of the brain that's active during a study. And in this case, they put people in an MRI and they showed them 3 things. One group, they showed them a magic condition first. They described magic as cause and effect being disrupted. So I expect something to happen, the laws of physics are not there, something levitates, or I take a $1 bill, I fold it up and I unfold it, and it's a $5 bill. That was unexpected, cause and effect was disrupted, that's magic. Then they had the The control, which is cause and effect, is upheld. I fold up a dollar bill and I unfold it and it's still a dollar bill. So that's the control. But they wanted to make sure it wasn't just surprising that a 1 turned into a 5. They were capturing the part of the brain that was actually activated when it was fooled. So they did a surprise condition. Like I'd fold a dollar bill up, I'd unfold it, and then I'd rip it in half and go, ta-da! And so cause and effect is still upheld. I'm still holding 2 pieces, but it was surprising. And believe it or not, a different part of the brain lights up for magic, and it's the same parts of the brain that light up during sedation, and actually that anesthesiologists try to tap into with anxiolytics. So we're actually kind of turning on the same part of the brain that we use to sedate when magic is encountered, and that could be a powerful tool for physicians. I should have done a trigger warning for clowns. I'm not a huge fan, but this was a study that said this was a study in pediatrics that they looked at kids getting outpatient procedures like a tonsillectomy, and they randomized them to the control, which was they were just with their parents all the way through induction, to the case, which was they had child life clowns with them from the moment they were in the waiting room all the way to induction. Again, that gives me palpitations, the thought of a clown over me as I'm going under. But this was the study they did, and they looked at things, a Yale preoperative anxiety score, validated tool, where a higher number means you're more anxious. And what they found here is that in the induction room, the clown group had half the anxiety. And there was no difference when they looked at the rooms, the patients before, when they were in the waiting room. So the kids didn't seem to know anything to be anxious about in the waiting room, but in the induction room, those that still had the clown actually had decreased anxiety and ultimately less anesthesia need. And then the last one's in the School of Dentistry, and they looked at, there's an actual billable code in dentistry that is called a strong-willed child. And it's a code that means I was not able to do the exam. I still saw them, but I couldn't do anything because I couldn't get them to sit I couldn't get them to open their mouth. I mean, I would love this. I've got 3 of these billable codes at home. But the concept was that they said, well, what if we taught these dentists a magic trick? And so the traditional approach is called tell, show, do in dentistry. I'm going to tell you I'm going to look at your teeth. I'm going to show you on a like on a stuffed animal, and then I'm going to do it. And this is kind of how they teach. So they had half doing the tell, show, do, and half learning a magic trick that took the same amount of time. And then they did the same thing. They in addition to looking at another anxiety scale, they looked at could they perform the exam and time to dental chair. And what was interesting is it was about 80 seconds faster to get them in the chair when they did the magic trick. Kind of over the length of the study, and they were able to get X-rays 91% of the time compared to 54% of the time in the non-magic group. So the reason I share this one is as we talk about, well, would I have time to do this? There's actually a time gained that can be leveraged here if you build that rapport and can kind of engage. So you now pretty much know the entirety of the literature on magic and medicine, so we can actually kind of get into what this can look like. And I just want to emphasize one more time, in all of my patient encounters, I might do a magic trick 5% of the time. There are times it calls for it, and I'll tell about kind of how to assess that, where I know that I can't get this kid's trust unless I can do this. But 100% of the time I think like a magician, and that's what we'll talk about today. So let's get started. I'm going to have you do something right where you're seated. So I want everybody to hold their hands like this, and you're going to turn your thumbs down so the backs of your hands are like this. Okay? I want you to take your right hand, come up, over, intersect your fingers, and come back. It's going to feel a little awkward. Your thumb's on the outside, just like that. So have you ever done this? It's a little bit of a neuroscience trick. You ask somebody to move their finger and they move the wrong one because when you're in this position. This is a little different. On the count of 3, I want everybody to do this. 1, 2, 3, just like that. Just me? I'm the only one? Okay. I'll show you how to do that in about five slides. So I'll teach you how to do that 5 slides from now. But that illustrates a point that is going to really be the crux of everything. At ease, you can lower your hands again. So I will teach you how to do that. But this really illustrates the entirety of magic. It illustrates what the concept of misdirection. Anybody that's ever opened a magic book, that's what they talk about, kind of how to get your audience to pay attention to one thing while you're doing something else. And usually, the something else is something you want to get away with. You know, they call it magic, like the dirty work. You're trying to actually get away with something. We have this in medicine too, where I need you to pay attention to something while I'm feeling your belly, or while I'm doing something that you might not be as comfortable with or want me to listen to your heart. And we'll talk about how to do that. So here's a patient. Her family gave us permission to use this. This was in med school, a residency, and the camera subtracts 30 pounds, I guess. But so this was in residency, and this was a patient that was in the hospital every day. So she actually was in the school of the hospital. And so I asked her to take one of the flashcards, and it had a calculator on it. And what you won't see in the picture is when she put it back in the deck, I palmed it out, and I was going to have it appear on my forehead. But if I just did this, that would have been pretty obvious. So I needed to give her something to do. So I handed her the cards, and I mixed them up so there's no way I could find it. She's so focused on this task, I have time to put her card on my forehead. She doesn't see it. I reach in the stack, and you can see where her eyes are. I show her the wrong card, and I say, I found it. Now, she can't see the forehead. Look at the look of disappointment on her face here as she sees I've gotten the wrong card. And then I actually lower it and see it. Disappointed, happy, disappointed, happy, disappointed, happy. So this shared moment of kind of revealing. But that, again, is leveraging misdirection, giving somebody something to do so that they don't pay attention to something I don't want them to pay attention to. There's a famous study called the invisible gorilla that I used to show the video, but I'm seeing a lot of nodding because most people have heard it. It's made the rounds. But this was a group, two behavioral economics economists at the University of Chicago that were looking at something called inattention blindness. So such focus on something that you ignore the literal gorilla in the room. So what happens here is they had 6 people passing a basketball, and the video would pop up and say, your job is to count how many times the basketball is passed. So they're walking in circles, passing the ball, doing bounce passes, etc. And you're going 1, 2, 3, 4. And about 10 passes in, somebody walks in, a research assistant walks into the middle of a circuit with a gorilla suit, bounces his or her chest, and walks out. And then they asked at the end of the video, how many times was the basketball passed, and did you notice anything unusual? And consistently, 60 to 80% of people do not see the gorilla. Across all, they've done this with expert witnesses and police officers, and it's consistently 60 to 80% do not see the gorilla walk in the room. And they're so focused on a task, they miss what's right in front of them. This has been repeated with clowns in colorful costumes, and they call this inattention blindness. And their work has actually been leading work in behavioral economics. Has been considered for Nobel Prize, part of this work, which makes me think it's crazy. Magicians have been doing this forever. This is what magic relies on, is getting you to pay attention to something while I do something else. Who noticed that while we did this, the chair of your department came in here in a gorilla suit and walked through? Anybody? Bring her on out. No, that'd be amazing, though. That would be good. I should do that. Jaws drop. So how do we do this? So we all got into the same position. So you're going to get here, hands here, right hand up and over. The only way to get out of this is to do this. And the way I did that in front of all of you was I locked my right hand in spot, and I said, perfect, your thumb's on the outside. So I separated my hands. The thumb is on the outside of your hand, but you all checked to make sure. So that doesn't even make sense. So what happens if you're in this position, you need to do not move your right hand, point with your left hand, and it's going to be very tempting to just come right back where you're trapped. You need to, I'm going to exaggerate it, all the way out, touch your thumb to your chest so the palms of your hands are like bookends, and then fold your hand in like you're praying. But you're going to hold it, so you point, you come around, and you reconnect in this position, but you hold it awkward like that. There's usually some remediation needs after this, and I'm happy I have some time. But so perfect, the thumb's on the outside. Now, if I just go like this, you all would have been, that was stupid, he just separated his hands, right? So you needed misdirection in something to think about, but I needed misdirection in time, too. So I actually even used space. I moved a little bit. I said, who's ever done the thing where you try to move a finger, which is like an old kind of neuroscience trick, but people kind of nodded and started to think about something else. And then I used misdirection in sound. If I just went like this, it looks a little too easy. So I said on the count of 3, go 1, 2, 3, just like that. So it made it just seem like it was a little bit harder, and everybody thought they weren't strong enough, and we're there. So, but that is getting away with something by giving you something to focus on, by giving you a task. So before I share some examples, what are some ways we're already doing this as pediatricians? So what are some ways you're leveraging, or you've seen it done well, misdirection as a pediatrician? Ear exam, how so? A toy, asking for a noise. My pediatrician used to say, I think Elmo's in there, or make a little Elmo voice. But certainly we've all done something with the ears. What else? Yeah, exactly. Really engaging, especially you're using misdirection of something they're familiar with, but you're also showing yourself to be a little bit more playful. One of the things I love about this lecture is I give it to pediatricians. I can't, we have a luxury of being in a field that we get to play with kids, and we should not lose sight of that, and take ourselves so seriously. I don't get asked to give this talk at OB meetings, was this your card? That would be. But so it's just it's important to be reminded that playful is part of our job description. And it really we should never take ourselves too seriously in that space. So yeah, I remember, speaking of neurology, I remember thinking that this Gendrastic maneuver, you remember when you go to get reflexes, thinking that had some majorly complex neuropathway activation of tightening these muscles. It's purely misdirection. You don't have to do this. You can ask a math question. You can say, what was the name of the second Harry Potter book? And if they pause to think, you'll get their reflexes. So it's misdirection. It's just a way that somebody figured out to kind of orchestrate it that does in a medical way. Certainly, those of us that have been taught to listen, destigmatizing an exam object, the flashlight, the stethoscope, the otoscope tip, something that takes the magic away is misdirection, or the fear away. Looking where you want them to look, not, who knows, you're not supposed to stare at the belly while you're doing the belly exam. You're talking to them about school or something like that. Even better, I'm sure most of us have been taught to, if I think somebody has appendicitis or a acute abdomen, I'm going to use my stethoscope first, and I'm going to pretend to be listening to what they had for breakfast and pressing as hard as I can in that right lower quadrant. And if they don't jump with that, they don't have appendicitis. So that's misdirection. We are telling them we're doing something, but we're doing something else, kind of under the guise of gathering information. And then sound. Sound can be a power, with the ear exam. People that just will make a silly sound during different parts of the exam, that can be a levity moment, but also a distraction. And I'm going to show a video of somebody that, I'll give you one more, because this is one other example, and I mentioned being an art history nerd. The ability to bend time. So there's a study out of Kansas that shows that there's one thing we can do that makes families think we spent more time with them. Everybody know what I'm talking about? Sitting down. So the study was that they had surgeons, they recorded the time spent in a room in a post-op check of surgery. And they recorded whether or not the surgeon was standing or sitting, whether or not they, how long they were in the room, and then they asked the family how long it felt like they were in the room. And when the surgeon sat, the families felt like they were in the room 40% longer than when they stood, and they were in the room 20% less. So they actually spent less time in the room and gained more perception of time. So they gained like a 60% swing in time by sitting down. And they've repeated this study in an inpatient setting with leaning, with like a leaning posture of not looking like I'm rushing to get out of the room. So I'm going to show a provider. I don't know his name. This is a YouTube video that circulated a while ago, but it shows a lot of these techniques. So pay attention to sound, destigmatizing the exam object, sitting, playfulness, movement, as far as misdirection.
Right. Yeah. Let's do mine. 1, 2, right. Yeah. Let's do mama's. 1, 2, right. Good. All right. Daddy's got your arms. Whoa, we don't like this. We'll say a 1, a 2, a right. Good. Yeah. All right. We'll say a 1, a 2, a right. Good. Yes. Okay. Bend it. It's a bend it. We need tissues. All right. Let's get your Band-Aids. Hold on to that. Good. We'll get your Band-Aids. Let's say. Let's get this one on. You're going to take it right off. I know you guys. You take them right off. We'll take this and good. All right, clean up. Everybody do this here.
Besides the waste of tissue, You can kind of see all of those techniques being played. Sound, sitting, he hands the Band-Aid, kind of movement, playfulness, music. Can really all work to your advantage here. So we're gonna learn this. What I want you to do is on the edge of every table. This is a little bit of an Oprah moment, but it's not as exciting. Everybody gets a crayon and an otoscope tip. So just pass those around, and if you need more, let me know. But everybody should have a crayon. Here, I'll give you guys over here. Yeah, thank you very much. So everybody should end up with one crayon and one otoscope tip. And we'll learn a couple tricks together. I'm going to show you this video next here to get us there. So I'll wait for everybody to have a crayon. We'll watch 2 videos, and then we'll learn how to do it. So as you're getting a crayon, just take a peek at this first video.
So we're going to teach you how to make any object a child is playing with disappear with another object the child's playing with. So let's say they have a coin nearby, or a pretzel, anything, and a crayon. So I'll show you how to make, using the crayon as a magic wand, make the coin disappear on the count of 3. 1, 2, 3. Oh wait, sometimes the wrong thing disappears. Let's see if we can get that back. 1, 2, 3. Comes back.
I'm going to show you one more version of it, and then I'll teach you how to do both.
So let's say they don't even have a second object. They just have a crayon. We'll show you how to do something with just that. So you would tell them you're going to do a test. On the count of 3, you want them to tell you what color the crayon is. 1, 2, 3, yellow. We can try to get it.
Okay, so I'll teach you how to do both of those, and then we'll move on. So this, again, you should remember now, everything is going to work by misdirection. Well, how did I misdirect them? I told them to look at something else. I told them I was going to make the coin disappear. And by saying I'm going to make the coin disappear, your natural instinct say, not on my watch, I'm going to watch that coin. And so you're staring at the coin so that when I go 1, 2, 3, and leave it behind my ear the 3rd time, okay, we'll show you how to do that in a second, your eyes have all been looking at the object in the hand, and they don't notice that I put it behind my ear. So here, in order for this to work, you have to have the rhythm such that every time you count, you put it behind your ear. Because otherwise you'll go like this. 1, 2, 3. So your rate limiting step for this to work is how long it takes you to get a crayon to sit. So what you do in front of Netflix tonight is just this. Like just practice sitting and going like this, taking and leaving a crayon. And then once you figure out the speed with which you can do that, that's what you do on your 3rd time. But every time, put it behind your ear. So you go 1, 2, 3. On 3, I leave it. Now here's what's going to happen. You're going to be so excited that you got it there. You're going to make it disappear up here. So you're going to go 1, 2, 3, and like go and be so excited it was there. You want it to disappear at the hand. So you're going to come back with an invisible crayon. You want to actually march down exactly like you were holding it. So 1, 2, 3. And then you act surprised with your body language that the wrong thing disappeared. There's a couple things. People say, well, what if they see it behind my ear? You're not at Carnegie. This is not America's Got Talent. You're in a patient's room. So like it's actually kind of fun if they see it. The kid will go, hey, it's behind your ear now. And it's like a second magic trick. How'd that happen? So like I don't make a big, I don't exit out of the room like this and make a big fear of doing it. So, but often I will just grab it while they're looking at the crayons. You can actually make a trick out of it. You could say, look at this. It actually went behind my ear. But if I want to make it disappear, I just go like that. And so what I did there was when I turned to show them it was behind my ear, whatever the object is, I drop in my pocket. So now I come back with nothing and then make it actually disappear. So you can kind of win twice, or 3 times. You made the crayon disappear, it appears behind your ear, and then the object actually disappears. And it's quite simple to do this. If you wear glasses or are struggling, I know people that will stick it behind their collar like that. So just kind of that same thing. 1, 2, and then 3, they leave it kind of in their collar like that. So, what's interesting about the psychology of magic is when the one changes color, and I probably do the color change one more for kids, because this will come up where I see them playing at their table, sitting at their table in their bed at the hospital, and they've got crayons out, and I can just kind of quickly, without saying, hey, can I show you a magic trick, I'll just pick up 2 crayons kind of stacked like this. So I've got them in my hand, so I've got one, a very different color. You don't want to go like purple to lavender, stacked on top of each other. And I say, how good are you with your colors? And I'll have them hold their hand out. And I just do the same thing. On the count of 3, tell me what color it is. 1, 2, 3, I leave it. And then I come back with this, but I'll just smack it into their hand and say, what color? And they say orange, and then it's blue. The part that's interesting about this, the psychology, when something disappears, your brain says, where did it go? And it starts looking for it, right? When something changes color, you don't say, where did the blue crayon go? You say, how did it turn red? And so it's a different psychology that happens. Nobody's looking for the blue crayon. They grab the red one and they start going like this. The one that changes. So it's easier to get away with because they're not going to start looking for the missing object. So there's a term in magic called heat. When you feel the heat of people looking for how you did it, you don't feel heat when you change the color because you've leveraged that psychology. I don't ever do this one for kids and hope that there are no ENT, but sometimes, for family, I go, oh gosh, it goes up the nose, it comes out the mouth. Okay, so we should all have an otoscope tip. This is one I do, again, as a hospitalist, it's certainly not every patient I'm looking in the ear, but I will use this, and I will use this one with teenagers too. We'll talk a little bit. Magic works once you have object permanence. So I mentioned before that, you can't do a complex magic trick and expect them to go, how did that happen? It's magic. But babies at 8 months, if you make something disappear, they start to look for it. That's like the definition. And that can be a joyful moment and can be used as a distraction. So I will do this as soon as somebody has object permanence. And I'll just say, do you mind if I look in your ear? These things all day have been acting up and disappearing on me. Like that one came up my nose. Do you mind if I see if we can find if you've got one hiding in your ear? And I'll put this one away and then grab the real one. So it's a very quick, based off an old thimble trick. So people probably don't even remember what thimbles are, but to not poke yourself. There was a whole genre of magic that used thimbles, and this can kind of work in this way. Now, I will say some people's fingers might not allow them to do this, and I can share a video of a different way to make something vanish. But basically what you're doing, I would encourage that you do this on your non-dominant hand, that you put this on your non-dominant hand. You're going to put it on your pointer finger, and you need to be able to bend it and pinch it like that. That's what you need. You have to have enough suction to be able to do that moment. So this is Netflix night number 2. And what happens is I'm looking at my palm of my finger, and I'm going to, the secret move is this: bend, pinch, straighten. So it's 3 moves. Bend. I always love if somebody walks in right at this moment. It seems very straight. Bend, pinch, straighten. And that happens behind this hand. And I think I just put my microphone. So I don't do that in front of you. I wait till my other hand blocks you from view. So I go kind of all the way to that knuckle that's going to bend, and I bend, pinch, and straighten. So I have a naked finger now behind my hand. So it goes. This strange thing has happened. As soon as it's covered, you don't see that I just did that. You might have seen my thumb move a little bit, but now you know what to look for. Cover, bend, pinch, straighten. So I've got a naked finger, and now I need to sell it like that was stuck on there. So I kind of pull it like this. Again, you're going to feel like a criminal right now because you're hiding something, but they don't know that. They don't know what you're doing, and you have a natural thing to be doing with your hand. I'm pointing at the hand that I thought that I just pulled the thing off of. So I point. If you really had nothing in your hand, you wouldn't go like this. And they've studied this in magic. They would actually look at what people did when they got change versus not change at counters. What naturally happens to your hand? It falls like a pendulum. So if I don't have something in my hand after I've pointed, my hand will just drop like a dead weight. It won't kind of robotically call attention to the fact I'm hiding something. So bend, pinch, straighten, drop my hand, make it disappear up here. I can kind of tap. I've got this kind of pinched. I can pull it from behind their ear. I can just let it go from my nose as I kind of pretend to do that. But it's done something to give me permission to look in their ear, like you mentioned before. What took literally probably 6 seconds. These have been acting up all day. This one keeps flying around. Do you mind if I take a look and see if I can find one in your ear? That's 6 seconds, and the kid wants me to look in their ear. As opposed to this thing where I'm having to tie somebody down to torture them. So that, and I should mention, I will send Angie a PDF that explains all of these tricks too, so you don't have to remember everything, and she can send it out to everybody that signed in. So a lot of what that highlights is what's called patter. So those that had their hands out here a little bit for having done a magic trick before will remember that they always tell you what to say. They give you a script. The script is what makes it go from an oddity or a puzzle into a performance. And so in medicine, I can leverage this. So again, rather than just saying, hey, look at this, it disappeared, isn't that neat? Now can I look in your ear? I leverage patter to make that have a story to allow me to enter their ear, to look in their ear. So it actually kind of leverages the moment for selfish gain, like it kind of can be the use of patter. So really being on the lookout for when that can be helpful. An example, again, it can allow me to use something to my advantage. It can allow me to look behind their ear. It can pop up in different, let's say the kid's then anxious about the belly exam. I can just say, oh my gosh, another one, and pull this, reach in my pocket and pull it from their belly, and now they want me to look again. It's kind of re-given permission there. Gives a chance to assess, play, and pretend. So I've had many behavioral pediatricians that come to this have started saying that they've been able to kind of use magic as a way to kind of assess the ability for their patients to enter imaginative play. And how they respond. And then it can allow you to draw attention to something that's important but mundane. I remember reading a study about hand washing that said that families in an emergency room, when they ask them, did your doctor wash their hands? Doctors wash their hands about 80% of the time. The families reported it about 50% of the time. So they were under-reporting how often we weren't doing it enough, but they were under-reporting the times we were. And one of the things they looked at is when the provider said, I'm going to wash my hands, then everybody remembered it. So adding this like audible memory. And so when I go to wash my hands, I often will do something kind of silly along the way. I'll say, do you mind if I need to get this checked out. I'm just going to go wash my hands and figure this out. This arm all day has been acting up a little bit differently than actually, I'm going to take off the coat to show you what that looks like. But yeah, this arm's just been acting a little bit different than the other one. Stretched it a little bit longer. Do you mind if I go just take a peek and figure that out while I wash my hands? This is so stupid. Obviously, what I'm doing is I just pull up my shirt and don't straighten out my arm, and then I straighten out my arm. But I grab it a little bit by little bit as I'm straightening out the arm as it goes out. The funny part is when I then go like this, which I could just as easily go like this, but the parents actually fall for it. So they go like, oh, isn't that cute? Like he's doing that. And then I go, yeah, I don't know if I should get this looked at. They go, my God, Sarah, like he has overcome so much. I mean, they like actually see this moment like and don't think that I could go like that. So that I'll use that sometimes if it's an older kid and this won't freak him out. I'll say, I just need to go look at my thumb while I wash my hands. Does this ever happen to you? You're like, ah, like where you can stretch it out, like ah. I just want to figure that out while I wash my hands. If you want to play with this, you hold your left hand out with your thumb. You bite the tip of your left finger. Your right hand covers your left thumb, and then you swap your right thumb into your mouth. So I'm going to go from biting my left to biting my right, which then allows me to do this, to basically hold and make one long thumb from the front. It looks very stupid from the side, like that. So I'm holding one long finger, and then I can push it back in like that. Now, the sound effect is really important. Watch how creepy it is without the sound effect. Like, you have to go like, ah! Like you have to do something like that to kind of make it. But again, this is a way to be playful with something that you have to do anyway, that then kind of makes kind of lowers. Often, what's the very next thing that's happening after washing my hands? I mean, there's a Pavlovian response to hand washing for kids. Of here it comes, I'm going to be uncomfortable, I have this kind of nervousness, and I've now like made laughter happening as that's walking to happen. So that can be pretty playful. The other thing that can be valuable in the rules of magic is the element of surprise. And so when you look at the rules of magic, like for magicians, it's rule number 1, never reveal your secret. So that one I'm breaking right now, and 2, I break all the time with patients. So if I have a kid that's going to be there multiple times, or they need to do something, they need to show that they can drink, or they need to get in a chair, I'll say, if I come back and hear you've been in a chair, I'll teach you how to do that trick. So I will teach tricks all the time. Probably every time I do a trick for a kid, if they're old enough, I will hold them hostage in a way to teach them, by teaching them how the trick, to get them to do something, to get to a chair, to try the medicine, etc. So you can really leverage it in that way. So definitely reveal these secrets. We're not training you to be performers. We're training you to be better pediatricians, and that can be helpful. But I will say, there are 2 rules of magic that you don't tell the audience what you're going to do. So you don't say, I'm going to make this crayon disappear, because you ruin your misdirection. And then you also don't repeat a trick immediately for the same audience, because that's the same thing. You just told them what you're going to do, and now they're going to watch the crayon. And that's why it's kind of fun. If you do it with the crayon, you change what happens when you ditch the coin in your pocket. You've now like actually changed what they're looking for. Houdini was actually a great card trick magician, and he did one trick 10 different ways. And he would fool magicians all over the country, because they would say, gosh, I saw that, and that can't be how it works, because this time he didn't do, and it was like his way to mess with magicians was basically having multiple ways so he could repeat the trick and it worked differently every time. So what does this really hinge on? It's basically saying don't lose the element of surprise. So I have one of these for everybody. I learned to not give it out until after the session because it makes a noise and it's very hard. But this, I carry couple things in my pocket. I carry this in my pocket, and I'll show you one other thing in a minute. But what this allows me to do is when I go to feel a belly, say, has that always happened? Or a joint exam, but it allows me to just have this, the little silly, I might go and just squeak their toe, as we kind of get them up. And I will say, I always show this now. Before I used to not do it, and I had done the belly button, and I walked back in, out there, and I saw the mom trying to show her husband, like, I swear, and she's like basically doing CPR. I was like, oh my gosh. So I always show it now. But one of my favorite things to do with this is if a kid has a stuffed animal, like their like favorite stuffed animal, and this is I mentioned like when do I need to do a magic trick? It's the kid that's like really timid and like looking at it and maybe cries as the door opens. They're holding, and I'll go, oh my gosh, I have this one. This is the one with the squeaky nose, and I'll squeak their Beanie Baby's nose, and the parents will go, we've had that for 17 years. And then I hold the Beanie Baby like this, so I'm now holding it, and I let the kid squeak the nose when they do it. And then I like toss it to the big brother or something who's sitting there like by the window, going this thing, and then I toss it back and I let the kid squeak the nose. But I like make it a complete non-thing. I'm just like, I'm the pediatrician. I remember this, like, and kind of let it not be a performance, but like leverages that element of surprise. So this is one of the few things, and sometimes it'll land in your pocket that you'll get the walks where you're squeaking in the hospital, But if I'm in an elevator with a nervous kid, I'll just press the elevator button. So this is like a very easy thing to have on you at all times. A joke I play on the nurses at the nursing station. I'll go up and say, gosh, my mom used to say like the way she knew my room was squeaky clean is if it could squeak. So she would always come up and like try to squeak my dresser to see if it could, if I dusted it right. And then I just walk away, and then they're going like this, And then I'll come back and be like, oh, yeah, looks like you got it, just a little squeak. So I've got one for everybody. Make sure to grab that at the end of the session. So I do want to kind of highlight, there's a concept in acting and theater called the cold open. So Shakespeare used to use this. Like a lot of times the show would just start. Somebody would walk on the stage, before the curtain came up. Or the cold open in Saturday Night Live is the Live from New York sketch, like the one where they say Live from New York or Saturday Night Live. So the cold open I will use when I need to immediately generate some sort of, this kid's nervous, I need to get them on my side. And this is where I'm going to not even go in as the pediatrician. If I see them really nervous, I might start with something like this. So this is the other thing I carry. If they have their pull socks on and they look nervous, I say, I'm just here to make sure the fireflies are okay. And I'll pull the pull socks off their foot and kind of check it and say, have they been flying? Because sometimes they'll go out the nose, out the mouth. Pardon me while I have a light snack. Oh, excuse me. And then I'll put it back on, and then my like live from New York moment is, hi, I'm Dr. Pitt. I'm one of the pediatricians supervising the team, or that's the live from New York. I'm like, oh my gosh, this has been fun. What's going on? This kid was nervous. He's engaged, and now I kind of will say who I am. So this is the other one this is the only one you'd have to buy, but they're $5 on Amazon Prime, and you can type like light up thumbs in Amazon. So they're thumbs that have a light bulb in them that when you press, and they happen, you can buy them in different colors, but the default is red, which is perfect because it's the color of a pull socks. And it really, so imagine this is the pull socks. If I go like this, and it looks magical, like for the kid, because their foot's nice. Can I borrow that for a second? And then what I'm not actually handing it back and forth. I'm just turning one off. But it looks like it's getting, and then just literally by and you would never hold your hands like this. Look, nothing in my hands. You're going to point your thumb and they sell them in all different skin colors as well. You're going to point your thumb at them. And again, they don't expect you to be doing anything. So I, as a point, make a big deal of doing this a lot when I'm talking to you before we start, because nobody's probably saying what's on his thumbs, you know, and then you can pull the light off. So this is one that you would have to buy. I have no financial link to that, but it can be a really easy one to carry in your pocket, and they'll last for years. That's the actual brand name version, but now they make them for $5 or $2 even, $2 a thumb, I think. So how can that help me? So it can prime a patient with less anxiety-provoking experience, which I mentioned. A really fun part about this is it gives you kid credentials. They don't care where you went to school. They don't care, you know, they're like, this guy's good. We need to Yelp. About what a great doctor this is. So like there's some value in that. And then I mentioned I might say, I'll show you how to do that later. Or if you come back, I'll do the fire. If you let me listen to your lungs, I can do the firefly exam again. So I have one more kind of concept to show you. I do need somebody to hop up and join me just for a second. Do you mind just coming up here for 1 second? Is it possible to have you join me? So this is just to illustrate a concept that we use in magic. So this, I don't do this trick a lot, but the concept is here. There are 3 crayons. I want you to just touch any 2 of the crayons and leave your hands on them. So you're going to touch any combination of the 2. You're sure? You're going to leave me the red. You sure? Okay, let's see what happens when I advance the slide. So it knew you would say red. I knew you'd pick red. So let's try it again. This time you won't be able to touch them, but give me a number between 1 and 6. 5. So we'll spell from where you are, F-I-V-E, green, and it knew you would pick green. So have a seat, and I'll explain how you can leverage both of this concept. This uses magic. A lot of the way magic works is to force somebody, to force them to feel like they had a choice, but they don't really have a choice. And a specific subset of a force in magic is called the magician's choice. This is where I have one outcome, but I have multiple ways to get you to that outcome. It's going to feel like a choice, but I have multiple ways. So if I need you to pick red, the next slide said that. I needed her to pick red. If she does this and covers up I say, perfect, leave your hands there. You left me red. There's no way I could have known you would do that. Let's say you'd gone like this. I'd say, great. We'll get rid of the yellow crayon. You've got the red and the blue one. Now lift up either hand. If you went like this, I'd say, great, keep your hand there. Is there any way I could have known you would have left yourself with the red crayon? If you'd gone like this, I'd say, perfect, I'll take the red, push the blue one aside. Is there any way I could have known you could have given me the red crayon? So every outcome leads to that. If I have 6 things and I need you to pick the third, 1, she says 1, O-N-E, 2, T-W-O, 3, 1, 2, 3, 4, 1, 2, 3, 4, 5, F-I-V-E, 6, S-I-X. But if you do it fast and confidently, it feels like, well, that was a weird way to do it from right to left, but it looked like he was planning on that. It's a way to kind of force a choice with the perception of, force an outcome with the perception of choice. So how do I do this in magic? In medicine, the most obvious is not asking a yes or no question, right? So, and I'm seeing nodding. We all have been taught this. Which ear should I look in first is very different than can I look in your left ear or can I look in your ear? Well, if they say no and you've got to, now you're like, you've lost your dynamic. So which ear should I look in first is the same to saying with your kids, do you want to do your math homework or your English homework first? You know, not do you want to do your homework. Another example is if I need to listen to an anxious kid's heart and I see them kind of tense up with the stethoscope, I start at the toe, right? I'll start with the stethoscope on the toe and go, not hearing anything. Then I'll go to the knee and I'll act a little confused. Then I go to the belly button still. And then usually by the 3rd spot, they grab it and put it on their heart. Because they're like, idiot, you know. I think I lose my kid credentials at that point. Like, Mom, I think we need a new doctor now. But you know, they will take it there for me. If I had tried to go there, they wouldn't have let me do it. And so that can be a way to use that skill. And then this is one I do a lot. I don't have to give vaccines a lot, but I have said this probably 200 times when I've been in a situation that I had to. Do I need to get a shot? I just immediately say yes, but we have a choice. We can do your arm or your eyeball. And they go, my arm, oh my gosh, that could have been terrible. Like, and it's so funny because the parents do this. They go, and then they go, oh, nice. Every time. I've never had a kid cry with the arm or eyeball. I've only had this sense. I've had kids laugh, but then half the time they're like, oh, my arm, oh my gosh, oh, Wow, that could have been terrible. So that's kind of an example of making a difficult choice seem less difficult when you put it in context. I will give one last example of this. We'll just do something in the room. A little bit of, nobody said there'd be math this morning, so I apologize. Just quickly think of a number between 1 and 10. And every time I have you do something with it, you could forget the previous number, so you only need to remember one at a time. So you're thinking of a number, I want you to multiply that number by 9, okay? If you have a 2-digit number, I want you to add those 2 digits together. And I want you to take your new number and subtract 5. So you should have a new number right now. I want you to go to that letter of the alphabet. So if 1 is A, 2 is B, so on, go to your new number's letter of the alphabet, and I'll wait, because somebody might have to go 26. Nod if you've got your letter. Okay? I want you to think of a country that starts with that letter. So you're thinking of a country. Once you have a country, I want you to go to the last letter of the country and think of an animal that starts with that letter. And once you have your animal, I want you to go to the last letter of the animal and think of a color that starts with that letter. So you now have a color, a country, and an animal, and I want you to beam those thoughts up here. Now that doesn't make any sense. There aren't any orange kangaroos in Denmark. Okay, so hands up, right? Hands up if you were thinking of an orange kangaroo in Denmark. It should be about 60% of the room. If you weren't thinking of a D, you did your math wrong, because any number times 9 gets you, when you add the digits together, you get 9. So 81, 8 plus 1 is 9, 9 minus 5 is 4. 72, 7 plus 2 is 9, 9 minus 5 is 4. So you're trying to get to 4. When you get to the letter D, did I have any Dominican Republic? It's been in the news, so that was probably top of mind. Democratic Republic of Congo, is that Djibouti? Any Djibouti in the room? Yeah. But usually, like, I start to speak faster. On the numbers, I give you all the time in the world because there's only one outcome. I even say I need to wait a little bit longer because you might need to get to 26. I know you should all be at 4, but I make it feel like you could have multiple choices there. But then once I get to the country, I start speaking fast. What's a country that you've got? Go to the last letter of the country. Do they have any koalas? Amber koalas in Denmark? Or, I would never do this trick one-on-one, but in a room full of people, you're going to have 60 to 70% of people that will go, oh my gosh, how'd you know that? And that really is just another way to illustrate magician's choice. Perception of choice, but really only one path to go. So as we reflect on how we spend our morning together, again, one, the joy of being a pediatrician, that we get to even be talking about this, that we get to be playful, that kids are going to think in magic, and we can leverage that magical thinking of things like misdirection, magician's choice, element of surprise, the cold open, ways to leverage what magicians have been doing for centuries in the way we interact with patients. And then, like I said, I'll make sure you all get the PDF that reminds you how to do the crayon, how to do the otoscope tip, the numbers for the math, etc. So with that, I will pause with 5 minutes for questions, but thank you guys for having me today. Thank you for the unexpected gift as well. So what questions can we answer? Thank you. If I wait long enough, right? Yeah. Oh, yeah. So I've never encountered, because I take the one and I put it away, and then I say, can I look, and say, nope, nothing there, nothing there. I've never had that, but it is the reason I don't do the crayon up the nose, because I don't want them to think, oh, look, I can shove this up there. They may think it's funny, but it's not. So yeah, I think it's important to know, like, there is a pulse check that needs to happen. I would not be doing this when I had to share a difficult diagnosis, right? I mean, so I will say chronically sick kids, though, parents still want their kids to laugh. And so, like, I've never gotten a vibe, like, from a family, well, that was inappropriate that you cheered my kid up. But your point is certainly well taken. You want to kind of know your audience when you're and let them in on it as well, so they're not accidentally.
Well, I'm just thinking about the way children think,
right?
And they're concrete, and so they may well think these things are in their ear all the time.
Yeah, no, it's a great point. So we think about words that we think so the talk. Who is a resident in the room? So we'll be meeting this afternoon and doing a talk on 8 types of jargon. So words that we forget that we learned the meaning of. And one category of that is euphemisms. And when we say things like bugs for bacteria, that has been well established that causes anxiety for families. That they think that there is an insect that you're looking for. And so like when we say we're looking for, there's a bug in your ear from an ear infection, or we're looking for bugs in the blood, and when they followed up, more than half of families think you're talking about some sort of insect, and that can be so you're absolutely right. We have to be very thoughtful. Even the way I asked the question, I did a magician's choice a little bit. I didn't say, do you have any questions? I said, what questions do you have? And this is we should be doing this at the bedside as well. It's been studied when providers ask the question, do you have any questions? They shake their head no more than half of the time. So they lead the witness. Do you have any questions? Versus what questions do you have is not a yes no question. It makes me say, I don't have any, or actually I was wondering about X, Y, or Z. So that a lot of this kind of magical thinking will apply this afternoon too, as we think about like simple word swaps we can do. Yeah.
The example I recall are, for example, in dental hygiene, little bugs in the teeth, and you need to brush your teeth to get, the images that can be frightening to children.
Yeah, you're right.
And so we need to remember they think about the world in a different way.
Absolutely, yeah. Yeah, in the back.
It's just about being a magician. Do you enjoy watching other magicians? Is there that same mystery? Or do you
There is a subset of.
You sort of know, you figure it out too quickly.
It's more the performance. So again, the puzzle of it, like how do they do it? It's more like, it could be a very dumb trick, but if they do it in a performance where that really kind of leverages story, and a lot of the America's Got Talent stuff has been doing that pretty well. There's a show on CW called Penn and Teller Fool Us, and it's kind of fun because it's magicians performing for the audience, but also for Penn and Teller. And then Penn and Teller is going. If they fool Penn and Teller, they get to open for their show in Vegas. And what's fun about that is watching Penn and Teller speak in complete jargon back to the magicians in front of a whole room, and explain how they did it. Well, using code language that I get to watch and go, yeah, no, they figured it out. But everybody else is like, what does that mean? And it really is the same experience in medicine, right? We do this all the time. We think that we're explaining things clearly, but we could be in front of somebody and they're staring at us. Like when we go to the mechanic and they start saying stuff and we get paralyzed because we don't know anything about cars. That's the life of anybody not in medicine when we talk about medicine. So I digress into plugging the talk for this afternoon. But yes, as long as it's less about the trick and more about the performance that kind of.
And then,
yeah.
Do you ever have a risk of families who feel like you're evil?
So it's a great question. So I do a lot of global health work, and I've worked extensively in Tanzania and Haiti. And Haiti has a culture of has a voodoo culture, and I've had to be very thoughtful about how that's. I used to do a trick in a restaurant, and one of my friends was a busboy from Haiti, and it was basically I had a flash bulb under my shirt that that had a wire that ran down to my toe, and if I pressed the toe, this flash of light would happen. So I would take the salt and pepper shaker and talk about a chemical reaction and could make a spark happen when I tapped him. And I had him do it once in the back. I was 14 years old, and he dropped the salt and pepper shaker and ran out of the restaurant. And I had to show him how this kind of worked. So it is thoughtful when you're going across cultures, especially cultures that have a high kind of like a voodoo or a component to belief. I've never encountered it. I just avoided it. Well, thank you guys for spending the morning with us. I'll see you Sunday.